Family synergy therapy was developed by co-founders of the Lighthouse Emotional Wellness Center, Dr. Ray and Jean Kadkhodaian, in response to a missing element in family therapy. Today, more than ever, the structure of the family is changing rapidly, and a new model is needed to meet the needs of these new family dynamics. 39% of children are born to unwed mothers. 1 out of 2 marriages end in divorce. 75% remarry. 1,300 step families are forming every day. 66% of those living together or remarried break up when children are involved. The blended family structure is more common today than a traditional family structure. These are the more common issues we've encountered at the Lighthouse over the past 10 years in working with families. Children over the age of 3 who cannot tolerate sleeping alone and share the marital bed with one parent while the other parent sleeps in a separate room. Parents who do not spend time together without the children. Children who isolate and do not interact with the family. Families who have endured a traumatic experience. Diffuse boundaries in the home and a lack of structure and discipline in the household. Children interacting more with social media and the use of electronics than family interactions. Families who avoid conflict or have conflict daily. Parents who undermine each other in front of the children. Family members who blame each other and do not take personal responsibility of their actions. Traditional family therapy has 1 or more children identified as having a need for treatment. The children receive therapy, but not the family as a whole. This results in a phrase coined in the psychology field as a clean fish in dirty water. This basically means take the child out of the environment, teach them new ways to think and act, but then return them to the family where the old dynamics and patterns undo the work done in therapy. Family synergy therapy, or FST, is designed to shift the entire family's dynamics and patterns in an efficient, cost-effective, and time-limited way. What is family synergy therapy? Family Synergy Therapy, or FST, is an 8-week structural treatment program for a family system designed to assess current dysfunction in the family, reconstruct dysfunctional roles, improve communication and attachment, create a safer environment to thrive in, which all leads to overall emotional health within the system. During the 8 weeks, parents will first learn important information about how we bond and emotionally regulate. Then they will learn how to provide emotional first aid to their child by modeling, so the child can also learn how to effectively regulate his or her emotions. FST integrates elements of structural family therapy, Bowenian therapy, and family systems therapy. FST incorporates conjoint therapy sessions, individual sessions, and conjoint co-therapy sessions. Family synergy therapy educates the parents on the concepts of attachment theory, boundaries, and personal responsibility, and psychoeducation is also provided on new behavioral approaches, communication skills, and conflict resolution. It creates a powerful, effective, and respectful relationship between each member of the system. FST is structured by having a parental coordinator facilitate all aspects of the treatment, which also integrates the children and the children's therapists by design. The sessions dedicated to parents are psychoeducational and personally targeted at the deficits in development that the parents need to create a healthy environment for their children to thrive in. Then the children are brought into the session so the parents can practice the new skills they are learning and experience changes in their relationship that they can then use at home. After the 8 weeks, the parental coordinator can be used to troubleshoot or correct new behaviors if needed. The parental coordinator serves as a coach for the parents and a facilitator of co-joint co-therapy family sessions. Additionally, each member of the family system works with their own therapist. Similar to structural family therapy, our role is to join the system. We align with the client as a conduit so that they may rejoin the system in a healthier way. Most conjoint sessions also focus on the dyads and triads where the dysfunction lies. Some of the families who could benefit from family synergy therapy are blended families, families unable to resolve conflict, disconnected or non-communicative families, families with a lack of structure and discipline, and families dealing with a serious crisis, such as an illness or death in the family. Thank you for listening about family synergy therapy and about our unique approach to counseling families. For more information about FST, contact the Lighthouse Emotional Wellness Center at 847-253-9769 or visit us online at lighthouseemotionalwellness.com.